Today in the osteology series, we are looking at the anatomy of the humerus bone. The humerus is a bone of the arm, and it is the longest and the strongest bone in the upper limb. So it is the longest and strongest bone in the upper limb, but not in the entire body. The strongest bone in the entire body is the femur, and the femur is also the longest bone in the entire body, and it is a bone of the lower limb. We'll look at it later. But for the humerus, it is the longest and strongest bone in the upper limb. It is a long bone with three parts. Now the type of bone under humerus is a long bone of the arm. It has three parts, that's the upper end, the shaft, and the lower end. The upper end has some features which include the head. Then we have the neck. The neck has, the humerus bone has three necks. We have the anatomical neck, the surgical neck, and the morphological neck, as we look in the future slides. Then we have the greater tubercle, we have the lesser tubercle, and then the intertubercular sulcus, or what we call the bicipital groove. The intertubercular sulcus is found between the greater and the lesser tubercles. Now the head of the humerus bone is smooth and rounded, and it forms less than half of a sphere. Smooth and rounded. It is directed medially backwards and upwards. Now the head of the humerus articulates with the glenoid cavity of the scapula to form the glenohumeral joint. The glenohumeral joint is the shoulder joint, what we commonly call the shoulder joint. So the head of the humerus articulates with the glenoid cavity to form the glenohumeral joint. So this is a diagrammatic representation of the upper part of the humerus bone. So here is the anatomical neck of the humerus. Then this is the surgical neck. Then this is the head. I've said that the head is smooth and round, and it articulates with the glenoid cavity to form the glenohumeral joint. Then this is the greater tubercle, then this is the lesser tubercle. Then the greater tubercle, between the greater and the lesser tubercle, that's where we have the bicipital groove or the intertubercular sulcus. The bicipital groove has two lips. We have the lateral and the medial lip. So we have the surgical neck, anatomical neck, then the head, which is round and smooth, to form an articulation with the glenoid cavity, forming the glenohumeral joint. Then here is also a diagram of the upper end of the humerus. Yes, the surgical neck, the head, anatomical neck, and then this is an impression for the supraspinatus muscle. Then this is an impression for the infraspinatus. Then this is an impression for the teres minor. It's just about the seat muscles that I talked about here. So we have the supraspinatus, infraspinatus, and the teres minor. Together they form the rotator cuff muscles together with the subscapularis muscle. Then the lower end present with the following features. We have the capitulum, the trochlea, the radial fossa, the coronoid fossa, medial and lateral epicondyles, and then the olecranon fossa. So here is a diagram illustrating the parts of the lower end of the humerus. We have the trochlea. This is the trochlea. Then this is the capitulum. These are very important in the elbow joint as they provide site for the attachment. Together with the radial fossa and the coronoid fossa, they provide site for attachment of the ulnar and the radial bone, respectively. Then here is the lateral epicondyle and the medial epicondyle. Then we have the medial supracondylar region. So this is the supracondyle region of the humerus bone. So this is where we commonly have the fractures, what we call the supracondylar fractures of the humerus. So this is the supracondylar region. So this is where we have the supracondylar fractures of the humerus bone. Lateral epicondyle, medial epicondyle. Then here we have the olecranon fossa. The olecranon fossa provides site for articulation of the olecranon process of the bone. This is the sharp end. This fossa provides the site for articulation of the olecranon process. Olecranon process is the sharp part that you feel when you palpate the elbow joint. Then here we have the lateral epicondyle, medial epicondyle. All these features can be palpated. Then another diagram just illustrating the lower end further. We have the medial supracondylar ridge, then the lateral supracondylar ridge. Supra means above, infra means below. So it's above the condyle, above the medial epicondyle. That's why it's known as supracondyle. Then we have the groove for the ulnar nerve. So this is whereby the ulnar nerve traverses as it supplies the muscles of the forearm and the hand. So any injury at this point, any fracture or any injury at this point will lead to an injury to the ulnar nerve, which will present in various forms. Then we have the trochlea of the humerus bone. We have the capitulum, then the olecranon fossa. This is whereby the olecranon process attaches. Then we have the shaft. The shaft is the longest part of the bone that extends between its lower and upper end. Now the shaft connects the upper and the lower ends of the humerus. Then it is cylindrical in the upper half. The upper half, you can say it is circular or cylindrical, then flattened anteroposteriorly in the lower end. So the shaft is the longest part of the humerus bone that extends between its lower and upper ends. So it connects the upper and the lower ends. So here is a diagram showing the shaft of the humerus. So here we have the intertubercular sulcus or the bicipital groove at this point. And this is whereby we have the lateral lip and we have the medial lip. Then here is the bicipital groove or the intertubercular sulcus, which provides site for the attachment of these muscles, the pectoralis major, latissimus dorsi, and the teres major respectively. So here is where we have the pectoralis major muscle attaching to the lateral lip. Then at the floor, we have the latissimus dorsi, and then the teres major muscle will attach at the medial lip of the intertubercular sulcus. Then we have the deltoid tuberosity where the deltoid muscle attaches. Then we have the attachment for the coracobrachialis muscle. Now this is a muscle of the arm and the forearm. Then we have a lateral view showing the attachment of the pectoralis major and the deltoid tuberosity where the deltoid muscle attaches. So this is the shaft of the humerus bone connecting the upper end and the lower end of the humerus. Then to determine the position of the humerus anatomically and its side, it should be holded in such a way that it is vertical. So you hold the humerus bone vertically, and then the rounded head at the upper end should face medially, backwards and upwards. So it faces medially, backwards and upwards. So that's where the rounded head will face. Then the lesser tubercle, greater tubercle, and the vertical groove. This we are just talking about the intertubercular sulcus. The upper end will face anteriorly. So this will face the front. Then the olecranon fossa on the lower flattened end will face posteriorly. So the olecranon fossa will face posteriorly. Then the tubercles, that's the lesser, greater, and then the bicipital groove or the intertubercular sulcus, they face anteriorly or forwards, and then the head of the humerus at the upper end will face medially, that is towards the midline, backwards and upwards. So this is how you determine the anatomical position and the side of the humerus bone. So you hold it vertically, then the head should face medially, backwards and upwards. Then the vertical groove, that is the bicipital groove, the lesser tubercle, greater tubercle should face anteriorly, should face forwards. Then the olecranon fossa should face posteriorly. With that, you'll be able to determine whether it is the right or the left humerus. As the following features, we have the upper end, the neck. As I said earlier, we have three necks: the anatomical neck, surgical neck, and morphological neck. We have the shaft. The shaft has three borders and three surfaces, and then the lower end. Now, the anatomical neck is a constriction at the margins of the rounded head. So it is a constriction. It surrounds the margins of the head of the humerus bone and provides attachment to the capsular ligaments of the shoulder joint. The capsular ligaments help provide stability or reinforcement on the shoulder joint. Then we have the surgical neck. This is a constriction in the upper end of the shaft below the greater and lesser tubercles. So the surgical neck is found below the greater and lesser tubercles, that is below the epiphyseal line or the epiphysis of the humerus bone, and it is related to the axillary nerve and the circumflex humeral bone. Now this part, the surgical neck of the humerus bone, is important clinically. Why? Because it is weaker than the more proximal regions of the bone. And what does that mean if it is weaker than the more proximal regions of the bone? It is one of the sites where humeral fracture or humerus fractures occur, leading to the damage of the associated nerves. And the associated nerve here, we have the axillary nerve, and the vessels, we have the circumflex humeral vessels. So surgical neck is important clinically to the surgeons. Why? It is weaker than the more proximal regions of the bone, leading to the humerus fracture. It is one of the sites where humerus fracture is occurring and leads to damage of the axillary nerves and the circumflex humeral vessels. Then the morphological neck is a junction between the diaphysis and the epiphysis of the humerus bone. The diaphysis and the epiphysis of the humerus bone. It is represented by the epiphyseal line in the adult bone. Then it is a true junction of the head and the shaft of the humerus bone. So it connects the head and the shaft of the humerus bone. So those are the necks of the humerus bone. We have the surgical neck, the anatomical neck, and the morphological neck. Those are the necks of the humerus bone. So here is a diagram. So this is where we have the surgical neck. Then below it, that's where we'll have the morphological neck. Then this is the anatomical neck, where we have the capsular ligament which surrounds the head of the humerus. Then the surgical neck, I've said it is important clinically, as this is whereby the humerus fracture mostly occurs on the upper end, leading to the injury to the axillary nerves and the humeral circumflex vessels. Then these are sites of attachment. We have the greater tubercle, we have the superior facet where the supraspinatus muscle attaches, we have the middle facet and the inferior facet. So it provides site for attachment of the seat muscles, supraspinatus, infraspinatus, and the teres minor. Then the greater muscle, it is the most lateral part of the proximal end of the humerus, as we have seen in the diagram. Then it is posterior superior aspect, bears three flattened facet-like impressions. So these are the impressions that we have seen in the previous slide. We have the upper, middle, and the lower impressions. So this provides attachment to the seat muscles. The mnemonic here is SIT, S-I-T. Supraspinatus at the upper impression, infraspinatus at the middle impression, and the teres minor at the lower impression. So the three muscles, the rotator cuff muscles, the seat muscles are attached at the greater tubercle of the humerus bone. Then the lesser tubercle is a small elevation, the front upper end of the humerus just above the surgical neck, and it provides this site for attachment of or to the subscapularis muscle. So the four rotator cuff muscles are the supraspinatus, infraspinatus, teres minor, and the subscapularis. The first three, that is the seat, attaches at the greater tubercle. Then the subscapularis muscle attaches at the lesser tubercle. Then we have the bicipital groove or the intertubercular sulcus. So this is a vertical groove that's found between the lesser and the greater tubercle. This is where we have the long head of the biceps and the ascending branches of the anterior circumflex humeral arteries. Then the muscles that attaches at the bicipital groove or the intertubercular sulcus, we have the pectoralis major on the lateral lip, teres major on the medial lip, and latissimus dorsi on the floor of the groove. So the groove has three parts: the lateral lip, floor, and the medial lip. At the lateral lip, we have the pectoralis major. The medial lip, we have the teres major. At the lateral lip, at the floor, we have the latissimus dorsi muscle. Then we have the borders. The borders, we have three borders: anterior border, which faces forwards. We have the medial border, which faces the midline. Then we have the lateral border, which faces outwards. Then the surfaces, we have the anterolateral surface, the anteromedial surface, and the posterior surface. So for the ossification of the humerus bone, the humerus bone is ossified in the following centers. It has one primary ossification center for the shaft, then three secondary centers for the upper end, and four secondary centers for the lower end. So in total, the humerus bone ossifies at 8 ossification centers. One of them is primary at the shaft. Then at the lower end, we have the 4 secondary centers. At the upper end, we have the 3 secondary center. And the ossification process begins in the 8th week of intrauterine life and ends in the 18th year of life. So that's the brief